Today we're going to talk about brain health as we age. So, aging and health. There are a few main factors that go into how well you age. Genes, environment, and lifestyle are just a few of them. They might be the major ones, but they're just a few. And obviously, the lifestyle choices that we make are what we can control. We can't really control our genes, but we can control the lifestyle choices that we make. So we're going to talk a little bit about some of those choices that we can do. So, some health risks. A lot of these we know about just from learning from our doctors, from TV shows, from whatever else, our families. But they're all worth mentioning because despite the fact that they're common knowledge, they're very important and they play a big impact on how we age at any age. So we're going to talk about a few of these in more detail, but the ones that I want to pay attention to are the ones that are most easily forgotten. So, unchecked health problems, poor diet, insufficient sleep. It's very easy to get lost in the hustle of every day and forget some of these things and just for convenience eat something that maybe isn't so good for us, or just sacrifice some sleep for extra work or spending time with the family. But they're all, like I said, very important. So medicines and brain health. As we know, medicines obviously affect our bodies, they affect our minds. They're going to affect your thinking and memory, depending on what kind of medication they are. And sometimes we can forget that, or we don't know what medicines are going to affect us in certain ways. So it's always important, whenever you go to the doctor, if you can, bring a list of medications with you. Have like an ongoing list, whether that's on the computer, on a piece of paper. Make sure that's up to date, and make sure that you remember to bring it with you. Because the doctor needs to know all these things when they're trying to treat. They don't want to make an assumption that's wrong. And sometimes medicines, for example, sleep aids, can affect your memory adversely. So definitely a good idea to write things down, make a plan. Smoking and brain health. So the effects of smoking have been documented, everybody knows, but it's always worth remembering. The benefits of quitting smoking can be seen at any age. In some cases, the phrase "it's never too late" applies, and in this case, the earlier the better, obviously, but it's never too late to stop. If you quit smoking, you're going to lower the risk of heart attacks, of stroke, of lung disease. You're going to have better circulation in your blood, and of course, we're not affecting others with secondhand smoke. So that's very important, especially as we age, because they're going to affect us more the older we get. Obviously, quitting is easier said than done. I don't know if we have any smokers, but it's not an easy thing. So there are a lot of free resources that we have that we can use and supply to help you quit if that's something that you need. It's not an easy process, but it's one that we definitely want to keep going with, and we want to try to get everyone to understand. Alcohol. So, everybody here, I'm sure, most people at least, maybe have had a drink at once in their lives. But we know poor driving, we know slurred speech, we know fuzzy memory. These are all things that happen when we're drinking. But what's important to note, that even with moderate use, impaired communication among your brain cells will occur. So make sure that if you're, we've heard the expression, glass of wine, antioxidants, that's true. But with chronic use, even moderate use, over time, long-term changes will occur with balance, memory, emotions, even your body temperature may change over time with chronic use or dependency, drinking alcohol. So staying away from alcohol, especially as we age, is an important thing to keep in mind. Because a lot of the problems that can occur will be reversed if we stop, if we stay away. So something to bear in mind as we get older. Another thing I want to point out is, of course, some medicines do not go well with alcohol. You don't want to take them because it's going to hurt you in some very bad ways, depending on the medication. So always talk to your doctor when you're taking a medicine if you plan on drinking, whether that's something that you should do. So, with all this great news, we're probably wondering what we can do to protect brain health. Like, how do we stave this off? Some of these actions you probably already know, but again, they're worth repeating. Eating healthy foods, being active, learning new things, connecting with family, friends, and communities. These are all things that are going to help you from the lifestyle, what we were talking about before. You may know it, but are you doing it? It's hard sometimes to balance a life with all these other things going on and being active and seeing family and cooking your own foods and, not really paying attention necessarily to how much health you're putting into them. So it's important, and we're going to talk a little bit more about it later, what we want to do with healthy foods, how we want to approach the idea of being active. And learning new things, it's always great. Doesn't matter how old you are, learning new things is fantastic. It's so much fun. Hobbies, that's the spice of life. So connecting with family and friends in a non-work related way, another very important thing. Because social connections help us grow, they keep us happier. It's a commonly known thing that people who either have experiences with family and friends that they know or volunteer experiences report feeling happier and feeling healthier. We'll talk about that a little bit more later too. All right, so again, this is sort of a recap a little bit. Managing your health problems that either you have, that you know you have, maybe you don't know, or that are unchecked. Diabetes, high blood pressure, high cholesterol, these are all things that we can manage. So this is all things that you have under your control. So you go to your doctor, you talk to your health practitioner, you go and you get these things managed because they're going to affect you adversely in some other way. Consulting with your healthcare provider to make sure that your medicines are right for you. So yes, so one doctor gave you this medicine, but maybe you stopped seeing them, and now you're starting with a new doctor. Always revisit. Have an actual visit where you spend time and sit down and talk to them about everything that's going on, especially your medicines, like we spoke about before. Reducing your risk for brain injuries from falls. It's not just being careful. It's taking action if you feel like maybe you're at risk. So shower safety. Installing something in the shower if you feel like that's a problem. So yeah, it's not uncommon, and it's certainly easily preventable sometimes. Obviously accidents happen, but we want to monitor that and mitigate it if we can. And we talked about quitting smoking, following with resources that maybe can help us. So eating healthy. Fruits and vegetables, we know that. Whole grains, lean meats, all of these things are very important. I bet if I asked, you would know most of these. But are we doing them? Maybe we are, and that's great. But it's very important every day. Not necessarily tomorrow you're going to become some super vegetarian and all your problems are going to go away. And nor should you do that maybe, because anything that you do, any major decision at any age, it's good to consult with a healthcare provider in terms of deciding what you're going to do. But we can do it slowly. We can add a serving of vegetables every day or every other day that we normally wouldn't have. We can trade in something that's for an unhealthy fat for a better fat or a lower fat content food. So these are things that, while it's common knowledge, it's important to remember. Adequate fluids. I know that when I'm working and I'm busy, sometimes I forget to drink water. And that's a problem because I'm giving you this talk and I'm telling you to drink water and I'm not doing it myself. So what can we do? What can I do? I can maybe carry around a water bottle and then refill it at the water fountain.
God bless you.
Bless you. And just remember, maybe have someone that's around you that can help remind you of what we're doing. We're going to drink water together every few hours, every hour, whatever it is. Drink more water than you're drinking now. This is the point. And it's important that you're drinking the right fluids, of course. So things with less sugar. So avoiding sodas and that sort of thing. So exercising, getting moving. it's going to reduce a lot of things. I mean, diabetes, heart disease, depression, and stroke are just a few of them. But I think one of the number one things, one of the most common things that I think you'll see when you go to the doctor, if you talk to a doctor, is how are you doing with your movement? Are you exercising, if you're able to, of course, in a safe way? But are you getting exercise? This is something in tandem with food that can really make a change. And it's easy to say, it's hard to do. A lot of these things are. But it's important to try to do them a little bit. Walk a little bit further. Take the stairs once or twice. Make a change that's not so ridiculous that it won't stick. That's what's important. And of course, safety, preventing falls. Always important, especially when you're exercising. At any age, it's always good to talk to your doctor when you're starting a regimen that is maybe a little bit more vigorous than you're used to. So that's something else that we need to keep in mind. It says here 150 minutes. Not expecting everyone to go and start 150 minutes of exercise every week. That's a lot. Eventually, though, we can work up to that. So maybe start out with 5 or 10 minutes a day where we're just focusing on exercise. So if we're going for that walk, it's not necessarily to get us from point A to point B, but it's to have the mentality that I'm exercising now. This is for my health. Just 5 or 10 minutes. They could be around the block. It's a simple change that maybe will stick around and will lead to greater change. These things tend to compound, and once you start doing one thing that's healthy, you'll start doing other things that are healthy. So there are programs that you can join. Doing it with a partner always helps because you're being supported, you're not alone, someone can keep you accountable for what you're doing. Keeping your mind active. So I like to read books. Some people like to read magazines. Playing games, and like we talked about before, learning new things. Good at any age. These are things, we're exercising our bodies, so why aren't we exercising our minds? And we do, because a lot of what we do every day is decision making. But these are extra things. A lot of them are fun. Whether you enjoy playing a game or reading a book or listening to a stimulating radio program, I like podcasts. Whatever it is, you're doing something that's keeping your mind active. We're not just sitting in front of the TV watching whatever it is that we're watching, because it doesn't really require a lot of thought most of the time. You're just kind of zoned out and not really engaged with what you're doing. So it's always good to try something new, maybe teach a class, whatever it is that you're interested in, or take a class. Be social through work or volunteering if you can. Obviously, not expecting you to incorporate everything, but a few things. So that's important to do because although it's not going to prevent you from getting Alzheimer's or whatever other dementia, it's going to help you overall in terms of your health. And there's a lot of studies going on that are now focused on whether brain games can have an impact. So that's sort of an ongoing field of study. Staying connected. So like I said before, volunteering, people who have volunteered generally report higher rates of feeling healthy, of being happier. So it's always great to do something for someone else or for a cause that you're into, or just participating in a group of people that have something like you in common. So an activity. And maybe it's hard to find because you've been doing your thing for a long time and it's hard to get out of your comfort zone. Try to find someone to do it with you. There's plenty of programs, senior centers, local community organizations that have opportunities. I've talked to people all the time. They say, I want to start dancing or something like that. I like to dance. And that's great. I'm always so happy to hear that because I also like to dance. But they're maybe not actually taking the initiative to go do it. And there's a dance in the community center for this person. And so when they start going, they're already feeling better and they're incorporating more things in their day. So staying connected is very important. It reduces some health problems, including dementia. So what about today? What can we do when we leave here today? Start small. Don't, like I said before, don't try to train for a marathon tomorrow. Take a 10-minute walk a few times a week, but make it so that it's the focused time for you. So I'm actually acknowledging that I'm doing exercise, and I'm not just walking to the supermarket, although of course walking to the supermarket's better than maybe taking a cab to the supermarket, and you're saving money. But these are the kinds of things that we're talking about. Adding a serving of vegetables every day, every couple of days, it is really not that hard. If you actually go and you try to incorporate this consciously, it can be done, and it'll make an impact over the long term. In fact, some of these things will have a pretty immediate impact. It's not something that you don't know, but again, this is why we want to be reminded. We want to help each other get better. Make an appointment for health screenings. So important. So we're going to talk a little bit later about what you can do for health screenings, not just physicals, which we do, but screenings that take a look at your brain and your cognitive function. They're out there, and you can access these resources every year, every 6 months, whatever your doctor recommends. You can go and you can follow up with some of these resources that will give you a screening and check and see how you're doing compared to others in your age group. This, I think, is very important. Writing down what you're going to do. So we've talked all about these different things. How you're going to organize it. You're going to make a plan. The best thing to do, maybe get a book. You don't have to buy one, but you can get a book, a little notepad, whatever it is. What's your plan? What are you going to do to make these things a part of your life? Are you going to maybe eat a little bit more fruit and vegetables? Are you going to start walking? Just write it down. It organizes you and keeps you, keeps your mind focused on what you're trying to accomplish. All right, so these are some common conditions that affect brain health. I'll just leave this slide up so you don't have to write it down, but they're important to remember. These are all things that you want to talk to your doctor about. If you have any of them, or if you've had any of them, just make sure that you're being treated for it. Make sure that your doctor gives you the appropriate screenings. Make sure that you're monitoring the different things that are going on in your body. And sleep problems. Easy to miss those. Maybe you're not aware of a sleep problem. There are doctors that are specialists in monitoring sleep problems that you can go see and get taken care of, because sleep problems, they do play an important role. We're looking at a lot of research now, in the past and in the future, that talks about sleep problems and how they incorporate into healthy aging and memory problems. So these are important to know. All right, so this is a graph that we're going to come back to a few times in the presentation. We're looking at cognitive function here and years of life here. And we don't have to understand exactly what we're talking about right now. Just remember that this black line, you'll notice, is normal aging, and this indicates maybe a problem. So if you'll notice, even normal aging, you're going to have some loss. It's completely normal. Now the difference we'll talk about later, but normal aging is not necessarily going to impact your life. It might a little bit, of course. Every day problems arise, and maybe we're forgetting some names here or there. But it's important to get checked out and see where you are in terms of your age group. Some things are not a problem, but others, as we'll talk about, can become one. So we're going to talk about each of these phases, stages coming up, and what we can do at each stage and what options there are. So what is normal aging? This is something you might find some difficulty remembering words, especially vocabulary that you don't really use every day. Maybe it's some vocabulary that you do use every day, and you're forgetting, I can't remember how to finish the sentence right now. And it can be alarming, for sure, but it doesn't necessarily mean anything other than normal aging. So problems with multitasking, decreases in ability to pay attention, you're still going to be able to learn new things. You still can create new memories. Normal aging is a process. And yes, you might find that you're forgetting some things, but it shouldn't directly impact your life in a significant way. And a significant way can mean lots of things for lots of different people. So that's why I said it's important to go and make that appointment with the doctor and make sure that what you have is normal. Not to freak out every time you forget a word, necessarily, because it doesn't necessarily mean that you're going to get sick. But just be cautious with anything, physical and mental. So we're going to talk about mild cognitive impairment. So MCI, if you remember, was on the graph. So this is something that we'll talk about in a little more depth. It's sort of that middle stage, if you remember, between the preclinical and Alzheimer's. Now that's a little bit of an oversimplification, but for our purposes, we're going to see what mild cognitive impairment is. In MCI, as we're going to refer to it from now on, because mild cognitive impairment is a mouthful, MCI people are going to have more memory problems than is normal for their age. So for someone, and of course there are a lot of factors that go into this, how much cognitive reserve, we won't really touch on that now, but if you're curious afterwards we can talk about it. The more memory problems than normal just means it's going to take into account how much you had before to start with. So it's a perspective. So what we're going to talk about is what's normal for you, but also what's normal for your age group. Now sometimes it's hard to determine without going to the doctor, because maybe you feel like forgetting a few words is a huge deal, and maybe it is, maybe it isn't, but it's important to go and find out what it is, where you are on the spectrum. So we'll go into a little bit more depth about this shortly. So older people who have MCI are at greater risk for developing Alzheimer's. Now, it doesn't mean that if you have MCI, if anyone has done a screening and they have MCI, it doesn't mean that you're going to have Alzheimer's for sure. There's nothing certain. It does mean that you're at greater risk, but that's all it means. So when you get the diagnosis, if you get the diagnosis, if anyone you know gets it, it's important to keep that into perspective. And all the things we talked about before, about monitoring your health in whatever way you can, will come into play even more, because you're going to want to do everything you can that's in your control to avoid getting worse. Alright, so we're back to this lovely graph. Again, we talked about MCI, and I think now we're going to move on to Alzheimer's disease.
Question? Can you go to the memory center and get a exam for baseline?
Yes, absolutely. We'll talk about more of that in the end, but you can for sure. In that, the Alzheimer's. So Alzheimer's disease. So I want to clarify something that is commonly confused. Doctors and people will talk all about these different terms. Let's understand it now. So dementia is the umbrella category. Dementia is the header that you can find a lot of different dementias under. And the most common type of dementia is Alzheimer's disease, which is why we hear about that all the time, but there are plenty of other types of dementia. Dementia is the loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with a person's daily life and activities. So when someone says you have dementia, let's just hypothetically say that doesn't exactly tell us what specifically they have. It's just saying that they have a loss of cognitive functioning that is more severe than perhaps MCI, and that it is affecting their lives in a more significant way. And Alzheimer's, again, a spectrum, is the most common type of that of dementia. We have lovely brain, and on this side we have a healthy brain, and on this side we have advanced Alzheimer's. It's not meant to scare anyone, it's just sort of to understand what exactly is happening. But Alzheimer's disease does lead to nerve cell death and tissue loss throughout the brain. We'll explain a little bit about the biology behind why that is, but that is what Alzheimer's disease is doing.
So the brain is shrinking.
The brain is shrinking. That's a good thing that you noted. It is smaller. All right, you are psychic a little bit because here's your answer. So we have a lot of different things going into what Alzheimer's disease is biologically. These two are probably the more commonly known things, and I'd like everyone to remember the beta amyloid proteins.
Yeah.
That's going to come into play when we talk a little bit about some of the studies that we have going on. So in Alzheimer's disease, not to get technical, if you want to discuss it more, we can talk about it afterwards, but we have plaques, we have tangles of beta amyloid protein and tau protein. And the buildup of these proteins in the brain leads to the death of brain cells, the loss of connections among your neurons in your brain, which are what brain cells are called. So try to remember these for later. We'll talk about how that comes into effect when we do treatments. So here we're talking about types of Alzheimer's disease. We have early onset, we have late onset, younger than 60, not very common, older than 60, that's what most people see when they're typically diagnosed with Alzheimer's disease. And the early onset, just to inform you, is more of the genetic predisposition of Alzheimer's disease. If you do have early onset, you're more likely to have one of the genetic mutations that predisposes you to getting Alzheimer's. So the majority of people, so these are some of the genetic risk factors, will have late onset, but there are plenty of cases, unfortunately, where onset occurs younger than 60. All right, so now we're going to talk about some medications. Okay, so bear with me with these words. So the acetylcholinesterase inhibitor, a very common form of medicine for the treatment of memory loss. And acetylcholine is a chemical in our brain that is involved in learning and memory. And if you notice here, if you just want to break down this word, you'll see that sort of esterase, if you look here, erase, maybe, sort of a key word or fragment of the entire thing that gets you to understand. Acetylcholine is a chemical, acetylcholinesterase is the enzyme that breaks down acetylcholine. And if we're inhibiting that enzyme, then that means we're going to have more acetylcholine. And the idea behind these medications is that we're trying to target the acetylcholinesterase enzyme and inhibit the breakdown of acetylcholine. And that's Aricept, Exelon, those are some medicines that you might have heard of. We've prescribed them, fairly common. So we'll look at some other ones in a minute. Okay, so here we have an NMDA receptor agonist, antagonist rather. So another form of medicine is targeting glutamate. Now, glutamate aids in memory and learning, but if levels are too high, it apparently appears to overstimulate the nerve, resulting in killing them. So the idea with these medicines is to avoid that. So it will help regulate any abnormal activity of glutamate. Another common medicine that you'll see in this category is Namenda. So if you've ever been to the doctor and they talk about Namenda, now you kind of have an idea about the interaction behind it. Actually, it's a great segue because here we're talking about symptomatic treatment versus disease-modifying treatment. And these are the different kinds of treatments that you might get. So, for example, the symptomatic treatment is something that we were just going over. So this is treatment that you can see. I don't know if you can see that, but it's not going to modify the disease. It's going to treat the symptoms and maybe slow it down a little bit. But there's differences. And what we're going to talk about later is a study that we have going on that is looking to actually modify the disease and potentially stop it before it even starts. Go into clinical trials. So it's a scientific study of how and if new investigational medicines work on people. So maybe you've been a part of a clinical trial, but this is sort of what we're looking at. There's a lot to a clinical trial, so if you're a part of one, you have every right to know, obviously, in the consent form, it should detail what is going to happen, and feel free, of course, to ask a million questions. That's very important. So all the research studies are going to be carefully monitored, very regulated. A clinical trial is not a joke. It's definitely something that has to go through so much approval, so much work behind it. You can be sure, of course, you should always know, but you can be sure that a clinical trial has primarily the patient's interest in mind, and everything should be detailed out for you when you try to start one. So it's definitely going to be something that you can be relatively confident in, and I only say relatively because you should be careful about anything you do. But a clinical trial is heavily monitored, heavily regulated, as you can imagine. So a lot of these have a lot of safety behind them. But always ask questions. This you'll see a lot. Participating is completely voluntary. You'll hear that a million times from the doctors and in the forms that you would have to sign. So these are some phases. We're going to talk about, so in all the phases, safety, you can see, is a primary concern, most of these phases. So the laboratory study, you'll see that, this is several years, and then we have several months to several years for these other phases. And then we'll have post-market surveillance afterwards to determine on a larger scale what the medication will do. So these little guys just mean that there's more people at each stage as you go up. And this is the stage where FDA approval, you'll find FDA approval. All right, so we're going to talk about disease-modifying treatments and a study that is targeting this section here of the preclinical before you get anything to avoid something bad occurring. Here we're going to have the potential, and we'll just discuss this study in a second. The A4 study. So this is a study that we'll talk about. That's the name of the study that Dr. Bell is involved in, that I am helping out with. So the goal is we're trying to determine whether we can prevent, like I said, memory loss in people who may be at a higher risk for developing Alzheimer's disease before they show symptoms. And that, I think, is a great goal. So we're trying to avoid all the things that we discussed, MCI, all the problems that can occur with unchecked memory loss. So So the A4 study, it's cleverly called the A4 because it's got 4 A's in the name. And we're looking at the first ever trial designed to prevent memory loss in people at higher risk for Alzheimer's disease, but have no symptoms currently. So we're testing a new investigational treatment, and it's called an anti-amyloid antibody that can prevent memory loss associated with AD. So some quick facts here. Obviously, like I said, you can hear it a lot. 100% voluntary, 100% confidential. There's no cost to participants, and we do reimburse for transportation. The study is on the longer side. It's 3.5 years, requiring monthly visits, but that's because we need to monitor and because it's quite an endeavor to do what we're trying to do. So again, you can withdraw at any time, 100% voluntary, but it may be worth looking into a little bit more. So the science behind A4, we're investigating, like I said, the drug intervention that aims to reduce the impact of amyloid, so beta amyloid. Remember I said before, try to remember that. This is what the study is looking at. The accumulation of amyloid in the brain, which is a possible key role in the development of Alzheimer's disease. So that, what we saw before, is what the A4 study is trying to look at. So who's eligible? 65 to 85-year-olds. We would do an evaluation with normal thinking and abilities. You would need to have a study partner. So if this is somebody who's, who's going to be like a family member, a friend, someone who knows you, and who can talk about how things are going, who can help you, who will be able to reach out to and ask questions to every once in a while. And willing and able, of course, you'd have to be willing and able to participate in all the study procedures. It's very regulated, as you might imagine. So we are looking at a focus on diversity. So although anyone is eligible for the study, there are many groups and individuals that are higher risk for Alzheimer's disease. We don't know why, but we're looking to find out why this is the case. So African Americans, Hispanic, Latino Americans, people over 75, and people with a family history are all people that we're looking at to involve in this study because it seems as though these people, these groups of people, may have a higher risk. The Memory Disorders Clinic. And so we have a variety of research studies. The first thing that you need to know is that for all of these, we have a complimentary screening of how you're doing, which we talked about earlier. I know some of you were interested in finding out a little bit more about how to get involved with checkups regularly. If you talk to me afterwards, there'll be a phone number that you can call. I can give you a pamphlet. And if you or anyone you know is looking to be screened, you can just give me a call and we can arrange that. So we provide free phone consultations, so you'll be talking to either me or one of my colleagues. We also provide memory evaluations, and of course, there's no obligation to join a study. We will talk to you about your options and what you can do as far as treatment. But if you just want to do the screening and you want to take the information to your doctor, your neurologist, or whoever is treating you, you can of course do that. That's 100% up to you. So here are just a few of the trials that we have. Currently, we're looking at the effect of your sense of smell, so how that plays a role in memory impairment, and whether treatment with one of the drugs that we talked about, Aricept, can be more effective depending on what your sense of smell is. So it's kind of an interesting study. And these other two we have here are for people who already are diagnosed with Alzheimer's disease. So if anyone you know is having any behavioral problems, if there's someone that is either agitated or restless, we have two options for you, which we can talk about. I have a brochure that I can give you at the end. Thank you very much I'm sorry we ran a little bit long, but if you have any questions or comments about any of the studies or anything that we talked about today, I'd like to invite Dr. Bell up here and we can answer any questions that you have. My name is Evan, E-V-A-N, but I will give you, if you are interested.
So in answer to the question about having a family history of Alzheimer's disease, if you have a brother or sister, or mother or father, what we call a first degree relative, and it's that illness, then your risk is maybe a little bit higher than someone who doesn't have a relative. But they have not found the gene associated with Alzheimer's disease in the regular later onset of the illness. For people who develop Alzheimer's disease in their 30s and 40s, they have found a genetic mutation, but that's different. Everyone in their family develops that illness in their 30s and 40s. Or for those of us who just developed a regular garden variety of Alzheimer's disease in our 60s, 70s, 80s, we have not found the genetic factor.